Social Welfare Administration and Registration of Welfare Agencies. Part 1. Meaning of administration. Administration refers to the process of organizing, directing, coordinating, and controlling resources, human, financial, and material, to achieve specific goals. It involves planning, decision-making, and execution of policies and programs to ensure effective functioning of an organization or system. Types of administration. A. Social Welfare Administration. Social Welfare Administration deals with planning, organizing, and managing programs aimed at improving the well-being of individuals and communities. It focuses on providing services related to health, education, housing, child welfare, and social justice. Key features. Implementation of government and non-government social welfare programs. Involves NGOs, social workers, and government agencies. Ensures equitable distribution of resources to marginalized communities. Examples: child protection services, disability support programs, and old age assistance schemes. B. Public administration. Public administration refers to the management of government affairs and policies to serve the public interest. It includes the implementation of laws, formulation of policies, and delivery of public services. Key features. Concerned with the functioning of government institutions. Encompasses activities like policymaking, budgeting, and governance. Includes administrative structures at central, state, and local levels. Examples: tax administration, law enforcement, and municipal governance. C. Social Security Administration. Social Security Administration involves managing social protection schemes that provide financial assistance and support to individuals in times of need, such as unemployment, disability, or old age. Key features. Ensures economic security for individuals through pensions, insurance, and welfare schemes. Funded through government allocations, employer contributions, and taxes. Aims to reduce poverty and enhance social stability. Examples: employee provident funds, pension schemes, and unemployment benefits. Social Welfare Administration. Functions of Social Welfare Administration. Social Welfare Administration refers to the planning, organization, execution, and evaluation of social welfare programs aimed at improving the well-being of individuals and communities. Key functions. Policy formulation, developing policies and programs to address social issues such as poverty, health, education, and employment. Planning and organizing, designing welfare schemes and ensuring their smooth implementation. Coordination, collaborating with government agencies, NGOs, and community organizations to deliver services effectively. Resource allocation, managing financial, human, and material resources for social welfare programs. Supervision and control, monitoring the execution of welfare programs to ensure efficiency and accountability. Research and evaluation, analyzing the impact of welfare programs and making improvements. Advocacy and awareness, promoting social justice and raising awareness about rights and welfare services. History of Social Welfare Administration in India. A. Pre-independence era. Social welfare activities in India date back to ancient times, with religious and charitable organizations playing a key role. Ancient period. Hindu, Buddhist, and Jain traditions emphasized charity and helping the poor. Kings and religious institutions provided support through temples, monasteries, and charity homes. Medieval period. During the Mughal era, rulers implemented welfare measures like free kitchens, hospitals, and rest houses. The role of community and religious leaders remained significant in welfare activities. British colonial period. The British government introduced legal and institutional frameworks for social welfare, but the focus was mainly on law and order. Social reformers like Raja Ram Mohan Roy, Ishwar Chandra Vidyasagar, and Swami Vivekananda worked to abolish social evils like sati, child marriage, and caste discrimination. Early social welfare laws included the Widow Remarriage Act, 1856, and the Abolition of Sati Act, 1829. B. Post-independence era. After independence in 1947, India adopted a welfare state approach, incorporating social welfare into the constitution. Constitutional provisions. The Directive Principles of State Policy, DPSP, emphasized social justice, equality, and welfare. Articles 38, 39, 41, 42, and 47 mandate the state to provide social security, health, education, and livelihood. 5-year plans and social welfare. First 5-year plan, 1951-56, laid the foundation for social welfare programs, focusing on rural development and poverty alleviation. Subsequent plans expanded welfare programs for women, children, scheduled castes, SCs, scheduled tribes, STs, and other vulnerable groups. Institutional development. Establishment of the Ministry of Social Welfare, later renamed the Ministry of Social Justice and Empowerment. Formation of the Central Social Welfare Board, CSWB, in 1953. Implementation of social security schemes like the Employee Provident Fund, EPF, and National Rural Employment Guarantee Scheme, NREGS. C. Social welfare in contemporary India. Social welfare in India today includes a wide range of programs and initiatives aimed at improving the standard of living of its citizens. Government schemes. For poverty alleviation, Pradhan Mantri Garib Kalyan Yojana, PMGKY, National Rural Livelihood Mission, NRLM. For women and children, Beti Bachao Beti Padhao, Integrated Child Development Services, ICDS, Maternity Benefit Program. For Social Security, Atal Pension Yojana, APY, Pradhan Mantri Jan Dan Yojana, PMJDY, and Pradhan Mantri Jivan Jyoti Bima Yojana. For education and employment, Midday Meal Scheme, Skill India, and Stand Up India. Role of NGOs and civil society. Organizations like SUA, CRY, and HelpAge India play a crucial role in supplementing government efforts. Community-based initiatives and self-help groups, SHGs, contribute to social empowerment. Challenges in social welfare administration. Bureaucratic delays and corruption. Lack of awareness among beneficiaries. Insufficient funding and resource allocation. Need for better coordination between government and private sector. Trekker's Principles of Administration. Principle of planning. Effective administration requires systematic planning to achieve organizational goals. Plans should be flexible, realistic, and based on needs assessment. Principle of organization. A well-structured organization ensures proper coordination of tasks, responsibilities, and authority. Clear hierarchies and role definitions help streamline administration. Principle of direction. Administration involves guiding and supervising staff towards achieving set objectives. Leaders must provide clear instructions, motivation, and necessary resources. Principle of coordination. Effective administration requires coordination between different departments, agencies, and stakeholders to ensure smooth functioning. Principle of communication. Open and transparent communication is essential for administrative efficiency. Proper channels of communication help in information sharing and problem solving. Principle of control and evaluation. Continuous monitoring and evaluation help in assessing the effectiveness of programs and making necessary improvements. Principle of leadership. Strong leadership ensures that the administrative team is motivated, disciplined, and goal-oriented. A leader should be adaptable and visionary. Principle of accountability. Administrators must be responsible for their actions and ensure proper use of resources while maintaining public trust. Nature of social welfare administration. Social welfare administration can be understood from two perspectives, as an art and as a science. Social welfare administration as an art. Social welfare administration is considered an art because it involves creativity, human interaction, and adaptability in dealing with social issues. Application of skills and experience. Administrators use personal judgment, experience, and interpersonal skills to manage social programs effectively. Problem-solving approach. Social problems are dynamic, requiring innovative and situation-based solutions rather than rigid formulas. Flexibility and adaptability. Since human needs and social issues are ever-changing, administrators must be flexible in modifying welfare programs. Leadership and decision-making. Effective social welfare administration depends on strong leadership and timely decision-making. Empathy and human relations. Dealing with marginalized communities requires a compassionate approach and the ability to connect with people. B. Social welfare administration as a science. Social welfare administration is also considered a science because it follows systematic principles, methods, and theories for effective governance. Based on theories and principles, the administration operates on established principles, e.g., Trekker's principles, and social work theories. Use of data and research, scientific research, surveys, and statistical analysis help in decision-making and program evaluation. Structured and systematic approach. Planning, organizing, staffing, directing, coordinating, and controlling follow a structured pattern. Objectivity and rationality. Policies and programs are designed based on logical reasoning and factual data rather than personal opinions. Evaluation and improvement. Scientific methods are used to assess the effectiveness of welfare programs and implement necessary changes.
Thank you so much for watching. Don't forget to like, share, and subscribe. See you in next video.